any point you decide you want to just read it by yourself, remember you can just turn off the video and go to the article. I will be explaining some of the words that I think might give you trouble, so you decide. Guiding question: why is understanding isotopes important to me? Goal: I can read for understanding. Directions: suggestion: do a split screen so you can answer the questions as you read. Click here to read the article alone, and click here for the video. Notice different colors are used in both the article and the questions. The colors tell you where to find the answers in the reading. Answer incomplete sentences with punctuation. And there in red, note, this article is about cancer treatments. If someone close to you has dealt with cancer, it is okay and completely normal to feel emotional. Take care of yourself. So I'm going to click here and open in Safari. And you don't need to because you're listening to me. But I also want to just mention, if you want to read it yourself, you can send this to Notability as well. So there's 3 little dots up in the corner, and I'm going to send a copy back to Notability. And the reason I'm doing that is then I can highlight on it and add notes and things. So here's the article. If you're reading by yourself, remember that the pictures are important as well. When you're reading articles, it will help you understand. So here it is. I am going to start by looking at the questions that are in black. The first questions are in black here. Remember that the different colors are used to help you know where to find the answers. So question 1, what is radiation? Question 2, which type of isotopes release radiation? Stable isotopes or unstable isotopes? All right, let's read. Nuclear medicine. That has to do with the word nucleus, right? Nuclear, relating to the nucleus. Using radioisotopes to diagnose and treat disease. Radioisotopes we're going to learn a lot about in this reading, but let's just talk about the word diagnose. That is the word for when a doctor tells you what's wrong with you or has figured out what is wrong with you. So they may diagnose you with COVID-19, or they may diagnose you with strep throat, or they may say, oh, you just have a cold, or they may diagnose cancer. So they listen to you describe your symptoms, and they do tests, and then they diagnose to tell you what you have. And treating disease means figuring out what to do to get rid of it, what treatments are needed. Going on. Background. What are stable and unstable isotopes? A stable isotope is a version of an atom that does not change over time. It is small enough with the right number of protons and neutrons to hold it together. Most atoms are stable isotopes. So here in the picture, we see the nucleus of a stable isotope has the right number of neutrons to glue the nucleus together. Going on, an unstable isotope or radioisotope. So radioisotope is another word for unstable isotope. It is one that cannot stay the way it is. It's kind of fragile, you might say. It's breakable. It's going to break down. Therefore, its nucleus will decay or break down. When nuclear decay happens, protons and or neutrons are released from the nucleus. The particles and energy released are called radiation. So radiation is particles and energy released from a nucleus. We look at the picture, we see that happening. Then here's the nucleus of an unstable isotope. It's pretty big, lots of protons and neutrons. And so it is fragile and breaking apart. Some energy is released and some particles and together energy and particles released from the nucleus are called radiation. Radiation is coming from the sun to the earth, but it also comes in much smaller amounts from different elements here on earth. Going on. Both stable and unstable isotopes are found naturally on earth. Bigger elements tend to be less stable. It's hard to hold together all those protons and neutrons. In fact, lead, with atomic number 82, is the largest element that has any stable isotopes. This periodic table compares the stability of the elements. Think about what I see, what it means, whiz, whim. Here's a key telling me these colors. So blue is mostly stable. Green is a little bit less stable. And then we get to purple being very unstable. And you can see as I travel reading left to right across the periodic table, the smaller atoms are mostly stable. There's one here that's green, but then we get to lead, Pb here that's got the arrow pointing at it. It's the largest element that has any stable isotopes. And after that, they get to be the green, orange, red, and purple colors. So what it means is that smaller atoms tend to be more stable. Maybe the nucleus being smaller, it's easier to hold together. But bigger atoms with lots and lots of protons and neutrons are more unstable and tend to be radioactive or radioisotopes. But, reading again here, but smaller elements can have unstable isotopes too. It depends on the number of neutrons. For example, hydrogen 1 and hydrogen 2 are both stable, but hydrogen 3 is a radioisotope. The ratio of protons to neutrons is out of whack, so the nucleus is fragile. It will decay. So hydrogen 1 and 2 are shown here in the blue box. 1 means a mass of 1, hydrogen 1, and that's the 1 proton, giving it that mass of 1 here, 1 proton in the nucleus. Hydrogen 2 has a mass of 2 because 1 proton and 1 neutron. But hydrogen 3, it almost has too many neutrons. So the number of neutrons needs to be right compared to the number of protons. So hydrogen 3 over here is not stable. And it's got a mass of 3 again because of the 2 protons plus 1 neutron, which you learned about in the last lessons. All right, that's where the black typing ends. So you might pause here and go and answer those 2 questions. I'm going to go back and read the next question that's in purple before we read about it. So number 3, what is the difference between how healthy cells and cancer cells divide? So what is cancer? Normally, cells live, grow, and die in a predictable way. Healthy cells stop dividing when they come into contact with other cells. That sounds like it might be part of the answer to our question. Cancer cells started as healthy body cells, but something has caused the DNA to mutate or change. They stop doing their job and instead keep dividing and forming more cells without the ability to stop. This creates cancerous growths called tumors in the body. To get rid of the cancer, patients usually start with having surgery, an operation to cut out the tumor. So here in the picture we see some normal cells and how they have stopped dividing because they're all touching each other. Once they touch, they know, oh, we don't need to make more. We'll stop dividing and we'll do our job in the body, which might be, if they're a lung cell, it's to get oxygen from the air and get it into the blood, or whatever job they have. But on the right side, we see cancer cells keep dividing and dividing and dividing, and they create a lump. So sometimes people realize they have cancer first by discovering a lump somewhere, and that lump might be cancer and it might not. So the next step would be to have the doctor check it out. But you see how the cancer cells are piling up, and they also stop doing what they're supposed to do. So go back and answer the question that was in purple. Now I will read the green questions. Number 4, how does chemotherapy stop cancer cells from dividing? Number 5, what side effects of chemotherapy did you know of before? And 6, why does chemotherapy cause these bad side effects? So let's read the green section, starting with this title here. Following surgery, there are often 2 main cancer treatments: chemotherapy and radiation. After surgery, the doctor often recommends further treatment to kill any cancer cells missed and remaining in the body. The 2 main treatments for cancer are chemotherapy and radiation. So we're going to hear about both, but this section is all about chemotherapy. The first, chemotherapy, involves taking anti-cancer drugs. These work by damaging the RNA or DNA that tells the cell how to copy itself in division. If the cancer cells are unable to divide, they die and the tumor shrinks. Chemotherapy causes many bad side effects. Unfortunately, chemotherapy medicines do not know the difference between healthy body cells and cancer cells. So these medicines hurt the healthy cells and cause very bad side effects. Especially vulnerable are the blood cells and the cells which line the mouth, stomach, and hair follicles. This results in fatigue, painful mouth sores, nausea, diarrhea, and hair loss. Many patients feel worse from the chemotherapy treatment than they do from the cancer. And you see a picture of a woman on the side who has lost her hair because of chemotherapy. And below it says, hats, wigs, or this beautiful henna crown can be used to help patients cope with hair loss. So you can pause and go and answer those questions, but I will explain a few of these words. The word vulnerable just means especially at risk. So, or especially, I guess at risk are the blood cells and the cells which line the mouth. They're vulnerable to the medicine. And fatigue just means very, very, very tired. Nausea is that feeling that you're going to throw up. Maybe you have kind of a headache or you're dizzy from it. You just kind of feel, ugh. So go ahead and answer those questions now that were in green. Let's read the red questions now. Number 7, how does radiation differ from chemotherapy? And 8, what is used to produce the radiation used in radiation therapy? 9, why does radiation cause less side effects than chemotherapy? Radiation treatment causes less side effects. The other option for treatment following cancer surgery is radiation. High doses of radiation, which is subatomic particles and energy, remember that's from the first section we read about, so you could go back and look at that again if you need to in the black typing. But high doses of radiation, subatomic particles and energy, can be delivered precisely to areas where the tumor is. Radiation damages the DNA of the cancer cells, causing them to die. The process of receiving radiation treatment is painless, and depending on the dose, side effects are limited to fatigue and skin irritation. Radiation comes from unstable radioisotopes. As we said earlier, radiation is the release of neutrons or protons from the nucleus of certain unstable isotopes. In nuclear medicine procedures, radioisotopes such as yttrium-90 and iodine-131 are given to the patient orally by mouth or intravenously with a needle into a vein. The medicine travels through the body to specific organs or cell receptors. There, the radioisotopes attach to the cells and begin to release radiation. The good thing is, this radiation travels only a short distance, so it does not reach healthy cells. Therefore, it minimizes unwanted side effects and damage, causing less discomfort than chemotherapy. So you can go back and answer the questions in red, but I'll explain a little bit more here. We see oral medicine is what's taken by mouth, and intravenous is when they use a needle and put it into your vein directly. But what's different here is the radioisotopes can attach just to specific organs or cell receptors. And so rather than the medicine going to all the parts of the body like it does with chemotherapy, and then making hair fall out and all those other side effects, it is just in that one area where the tumor is. And then it releases the radiation right in that area where it's needed. I'll go back now and read the questions that are in blue. Number 10. What is another use of isotopes in medicine besides treating cancer? And 11. What is the mass of the iodine isotope used to take the thyroid picture? So we're here. Other medical uses of isotopes. Radio imaging to show organs, blood, or cancer in the body. Radio imaging, so the word image is like a picture, a photo, an image. Radio imaging is the use of radiation to do body scans and show pictures of the inside of the body, including cancerous tumors. Radiologists are people trained to take these pictures, which help doctors make the diagnosis. So that ist suffix always means a person, so it's a person who does radiology. So radiologist is a person who's trained to take the pictures. We see a radiologist here in this picture. How does radio imaging work? Again, radioisotopes are given orally or intravenously, and they move through the body to attach to certain cells. Then they start emitting radiation. So there's a patient over here in the machine who was given the radioisotope previously. And then a camera-like detector, so I'm reading here again now, camera-like detectors in machines outside the body see the radiation emitted from the radioisotopes. The image shows a dark spot where the radioisotopes attached. So the machine here sends an image, and then the radiologist can look at it, and the doctor will also look at it. Because the radioisotopes can attach, reading here, because the radioisotopes can attach to even a single cancer cell, they can identify medical problems at an earlier stage than other diagnostic tests. Early diagnosis is very important to curing cancer. Comparing X-rays to radio imaging. Radio imaging may seem similar to X-rays, however, they show different things. X-rays only show bones and solid objects in the body. On the other hand, radio imaging can show pictures of soft tissue. See below to compare images made by these different methods. So on the left we see the X-ray shows the hard tissue, bones, teeth, and other objects. And I'm reading here, the X-rays are sent through the body and bounce off solid objects back to the camera. And we see an elbow bone here. It's an x-ray of a child's broken elbow bone and the screw used to fix it. On the right side, we see radio imaging shows soft tissue, organs, tumors, flow of blood. Radio imaging of the thyroid gland using iodine 123. I think it asked for that in one of the questions. So a person was given iodine 123 as a medicine, kind of, only just being given it to take these pictures. The thyroid gland is up here under the neck, and a doctor would know what they're looking at here. As untrained people, I don't really know what they would see, but same thing on this side. It's a brain scan taken with radio imaging using technetium-99, and again the doctor would use that to diagnose if there's a problem in the head, maybe with blood flow or maybe a tumor or something that they're looking for. So you can go back and answer the questions that were in blue. And and I'm interested that this technetium-99, if we go back to this periodic table, that's actually this one in the middle, 43 here, TC. So that's the one they use for those brain scans. All right, go back and answer the questions. Double check that you have capital letters and punctuation, and then submit it to Schoology assignment 9.7, Isotopes in Medicine. I hope you found this interesting. Thanks for your hard work.